So we thank her very much. It was good advice given to us nurses and more so midwives. At this point, we want to welcome Dr. Adini, obstetrician and gynecologist, to the little podium that we have here invisible to do his remarks. Welcome, Dr. Adini.
Thank you very much. Sorry. Good afternoon, everybody. Thanks. All protocols observed. It's an informal setting, sort of, and I was hoping for a bigger audience, really, hoping that general population will be here, because I will talk specifically on a very common subject, hypertension in pregnancy, and essentially it is what we can do about it, how we can prevent it, because the essence of discussing important topic like this is to be able to prevent occurrence of risk. And as medical practitioners, as midwives, as nurses, that is our goal, and particularly antenatal care. In antenatal care, the main reason why we conduct antenatal care is to enable us to identify risk in each pregnancy and then manage such risk, anticipate what could go wrong, and then design a plan, customize a plan for the particular woman in question, and see to it that we reduce, if not eliminate, potential complications that could happen in pregnancy. So when we talk about hypertension in pregnancy, what do we really mean? Essentially, the broad classification I will give it to be: number one, there is a group of women with pre-existing hypertension in pregnancy, what we call essential hypertension or high blood pressure in pregnancy. And such women will be at risk of developing what we call pre-eclampsia. Now, when we use the word pre, we are saying before eclampsia. So that is what pre-eclampsia means, before eclampsia. And so what is eclampsia? Eclampsia is a condition which could complicate pregnancy, and usually it occurs when there is a significantly elevated blood pressure and presence of proteins in the urine, what we call proteinuria. And when you have the two being present and the woman undergoes seizures, then it becomes eclampsia. Right. So pre-eclampsia is before eclampsia, and that is also a condition that is confined to pregnancy. Specifically, it occurs in the second half of the pregnancy. In other words, when the woman is 20 weeks pregnant or more. So it occurs in the second half of the pregnancy, and it manifests with high blood pressure. And when we talk of high blood pressure in pregnancy, generally we are talking of blood pressure above 140/90, thereabout. It could happen in blood pressure that is lower, and that's why it's important for patients to book on time, because generally speaking, some have taken the definition to mean a systolic blood pressure. Systolic blood pressure is the blood pressure, the first one, the higher of the two blood pressure readings. A systolic blood pressure of 30 or more of mercury, 30 millimeters of mercury or more above the booking blood pressure. And the diastolic one is 20 millimeters of mercury or more above the booking blood pressure. And that's the second, the lower blood pressure. And so when we talk about preeclampsia, like I was saying before, it is occurrence of high blood pressure in the second half of pregnancy, and in the presence of proteins in the urine, what we call proteinuria. In the lab, we normally will measure it, and that will be proteinuria in excess of 0.5 grams, which is about 500 milligrams over a 24-hour period. So now, I've just been talking about some jargons to some people who are not medically trained. So essentially, the main thing with preeclampsia is that it could be prevented, right? Risk could be minimized, and that's why it's vitally important for all women who are pregnant rather, to book very, very early. And more so for those who have pre-existing conditions, things like diabetes mellitus, things like what we call essential hypertension. There's a group, there is a specific group that are at risk of developing high blood pressure in pregnancy, and I'm going to list them for you. Number one, if you are having your first baby, then you are at risk of developing preeclampsia or high blood pressure in pregnancy. Number two, if you are having the first baby for a new partner, right, then you are at risk of preeclampsia. Number three, if you are aged 40 years or more, you are at risk of developing eclampsia. Number four, if you are expecting more than one baby. Number five, if you are pregnant of what we call a donated eggs, right, egg donation, then you are at risk. Number six, if your booking weight is more than 90 kilograms, I think in pounds, what's that? I don't know, because I know I do tell them that I'm of this generation, so I use kilograms, right? So I think that would be around about 200 pounds, roughly, right? If your booking weight is 90 kilograms, or your body mass index is 30 or more, then you are at risk of developing preeclampsia. And of course, if you've got pre-existing condition, like I said before, diabetes mellitus, or you've been told before, maybe while taking the pill, you discover that your blood pressure was elevated, then the risk of developing preeclampsia is significantly raised. And that's why it's vitally important for women to book very early. First of all, to kind of get what we call the booking blood pressure, right? A midwife will normally do that when the booking is being done. Booking blood pressure is recorded, and then we can observe the difference between the booking blood pressure and blood pressure in the second half of the pregnancy. And of course, more so if you have pre-existing what we call the essential hypertension, because preeclampsia can complicate a pre-existing high blood pressure, and which will mean that yes, the blood pressure is still high. Then the second half, there is development of passing proteins in the urine, right, which we call proteinuria, and of course the blood pressure starts rising. Okay, so what can we really do for you if you have any of those things I have mentioned? According to available evidence, the current evidence suggests that if you are at risk of developing preeclampsia and you are seen early, starting you on aspirin, low dose aspirin, 75 to 150 milligrams once a day until about 36 to 38 weeks of pregnancy will significantly reduce the risk of developing preeclampsia in that pregnancy. And then of course I'm going to tell you later on in my presentation why it is important even after your pregnancy to follow you up, because there are significant risk that you could have later in life if you develop preeclampsia in pregnancy. And so what then happens? So when we are able to assess the at-risk group, and we start you, if we think you are able to, you will benefit from aspirin, we do that, and then we monitor you continuously, kind of see you more regularly. You might not be the kind of patient that will stay at the health center. Certainly you're going to be seen fairly regularly at the hospital. And over there, we may have to admit, depending on how high the blood pressure is, because one specific thing about preeclampsia is that it's one condition that doesn't go away, right? It can be managed but cannot be cured. The cure to preeclampsia is delivery of the baby, right? And of course, if you are 24, 25, 26 weeks, it is something that we wouldn't want to do straight away, and that's why we may have to admit to hospital to ensure we stabilize the blood pressure and prevent further complications from happening. Because in the UK, there's something called confidential inquiry into maternal death, which is done every 3 years and all that. And what has been found out is that of late, because in the past they have tried to prevent a number of problems, fluid management in the course of managing those with severe preeclampsia and eclampsia. And of late, one of the things that seems to have been coming on is development of stroke, and that will happen when you have blood pressure rising above 150 millimeters of mercury. So basically, when it comes to managing this condition, like I said before, you may need hospitalization, and essentially we may have to deliver the baby, which in some cases may be in the premature condition. And obviously we will discuss all that with you when you, if you have to more or less need that kind of intervention. And now, why is it important after you have had a baby where the pregnancy was complicated with preeclampsia to keep checking on your blood pressure? The reason is that not too long ago there was this very interesting research that discovered that if you have preeclampsia in the course of pregnancy, the risk of developing further complications later on in life is about 30%. Right, and the complications I'm talking about will be development of high blood pressure, development of heart disease, development of stroke, and all these other things. So it's quite high, and that's why it's so important. If you are diagnosed with preeclampsia in your pregnancy, then you should watch your weight, cut down on salt, exercise a bit more, check your cholesterol levels fairly regularly. And when we do all of this, then obviously things will move forward in a smooth way. And most importantly, my take-home message today for those who are here is to ensure they book fairly early. And if you have pre-existing condition, liaise with your doctor before attempting to conceive, so that the outcome of your pregnancy could be something we will all celebrate without any complications. Thank you very much. I don't know whether
Dr. Dini.